welcome to the Crow's Nest. I'm Adonis Montgomery.
And I'm Ty, and today is Wednesday, February 1st, 2017.
At this time, let's pause for a moment of silence.
Please stand for the Pledge of Allegiance. Attention, salute, pledge. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our message for today is about standing up for what is right.
When we practice justice, we get in the habit of doing our duties and performing at our best, no matter how we feel. If we're having a terrible day, don't take it out on others.
I'm Gretchen Rubin, and this is The Happiness Project. The pigeon of discontent for this week is, especially when I'm struggling for a positive view on things, I get easily annoyed by my loved ones who display their bad mood in facial expressions or in what they say. Mostly, I unwillingly adopt that mood, even though I'm aware of what's happening. Now, this reader is pointing out a very well-established psychological phenomenon called emotional contagion. We actually do catch emotions from each other in milliseconds. A mood will pass from one person to another in a flash, or even from a photograph of someone's face, or over the telephone. So we're very, very sensitive to other people's moods, and we really do catch each other's moods. And unfortunately, bad moods are more catching than good moods. Now, what is it that you can do when you're with somebody who is infecting you with this bad mood? Well, it's very hard to inoculate yourself to it. One of the things is if somebody is very hard to deal with, to try to communicate with them by email, or even to just be aware of it. That's really the best thing that you can do, is to realize that someone's getting a bad mood and trying to be as mindful of it as you can be, so that you are not just unconsciously swept along with it. So unfortunately, there's not that much you can do because we are so sensitive to each other's moods. So try to be mindful of other people's moods.
For lunch today, our menu will be pizza or Italian dunkers with sauce, corn, broccoli, salad, or banana, or a grab-and-go meal.
Congratulations to the 48 potential new initiates who received invitations to join our Junior Honor Society. Your paperwork and dues are to be returned by February 2nd, and, save the date, the JHS induction ceremony and reception will be held February 8th at 9 a.m. Current members should see Ms. Peoples to sign up to bring food for the reception. Finally, 6th grade students who are asked to usher and act as hostess should give Ms. Peoples your decisions as soon as possible.
The annual scoliosis screening will be tomorrow during PE. All students should attend PE for this important health screening. Here's a look at the conditions.
Sometimes a person's spine curves and rotates, making it look like an S or a C. This is called scoliosis. Because your ribs attach to your spine, when the spine rotates, it raises the ribs and creates a rib hump. This is especially noticeable when you bend forward. Do you see it here? You may also notice differences in your chest or breast size, your shoulders, or your waist. They may appear uneven. The curve may become larger as you grow. Curves in the middle of your back that reach 45 to 50 degrees will probably increase throughout life. If the curve is greater than 70 degrees, it can affect your breathing. Curves in your lower back that reach 35 to 40 degrees may also get larger throughout life. In most cases, we don't know what causes scoliosis, and we call that idiopathic scoliosis. Scoliosis does not come from carrying something heavy like your backpack or from bad posture. Scoliosis does not cause back pain in most patients. There are many treatments for scoliosis. Your doctor will consider the size and type of your curve, how much growing you have left to do, and if you have any other medical conditions. Many times, treatment includes watching your curve and also regularly getting an X-ray. Sometimes wearing a brace is effective for curves between 20 and 40 degrees in children who are growing. But wearing a brace does not make the curve smaller. The goal is to prevent a curve from progressing or getting bigger. Many families ask about alternative treatments. Physical therapy, massage, acupuncture, and chiropractic care can help some people with back pain. But there is currently no good scientific evidence showing they can prevent progression of a curve or improve the curve. Discuss these therapies with your provider. For larger curves, your doctor might recommend surgery. No matter how your doctor treats your scoliosis, don't let it stop you from being active or participating in sports or other activities you enjoy. Follow your doctor's instructions and call the spine nurses if you have any questions.
Today is a 60-40 day for Winfield City Schools. We will be on a shortened schedule all day, and students will be dismissed around 11:45. Enjoy your afternoon off.
The Crow's Nest would like to wish a very happy birthday to Abby Alexander. Enjoy your special day.
That's the view from the Crow's Nest.
Have a wonderful Wednesday. Keep it fresh too.